Good afternoon, everybody. Thank you for joining us this afternoon. We are excited to be with you again and having conversations on COVID-19 and Black communities. This webinar series is sponsored by Black AIDS Institute, the Multicultural AIDS Coalition, House of Blanca, Southern AIDS Coalition, and Harvard University CFAR. This session today will be about how generations of trauma fuel COVID-19. As you know, we have this webinar series every 2 weeks. And so we are excited about our topic today, and I'm going to hand it over to Dr. Stefan Wallace.
All right. Hello, everyone. Hopefully you can hear me. Thank you for joining us on this Tuesday to talk about this very important topic about historical trauma and its relationship to the health and wellness of Black communities amid COVID-19. I'm going to first start with a brief, but I think important tradition that we've done in our previous webinar series, which is to really ground us in this conversation, to have sort of a mindfulness exercise. So bear with me for a moment. For this exercise, if this one I like to call 3 hugs and 3 big breaths, and it's one of my favorites. So with this particular exercise, you will give yourself a hug, you will squeeze, you will breathe in, you will breathe out. Then you will embrace again yourself, squeeze, breathe in, breathe out, and then do that once more. So let's all get together. So we're gonna hug ourselves. I'm gonna breathe in. I'm gonna breathe out. I'm gonna squeeze more, breathe in, breathe out. And last time, squeeze again, breathe in, and breathe out. Awesome. Thank you for indulging. So before we jump into the main event, I want to do just a brief sort of roll call of who's all here. And then one of our speakers is going to give a clinical update. So on the call or for this meeting, we have Dr. Basola Ujukutu, who is from Harvard CFAR and Harvard Medical School. She's going to give our clinical update. We have Dr. Michelle Andrasic from the HIV Vaccine Trials Network and future Dr. Martez Smith from the University of Rochester. So if you could do your clinical update.
Sure. Thank you, Stefan, and good afternoon, everyone. Again, thank you to the organizers for assembling the outstanding speakers who you will hear from and really focus in on things that they're talking about today. So this is the 4th in our webinar series, and during each of these conversations on COVID with the Black community, I provide a brief medical or clinical research-related update in regards to COVID-19. And the topics that I address are really drawn from the headlines or from my own sort of patients or my clinical network. And thus far, I think we've talked about some really important things. We talked about transmission, risk factors, some of the associated findings that we're noting in terms of blood clotting and neurologic complications. And we've also talked about something that I think is really important, and I'm going to emphasize again today, continuing social distancing, physical distancing, even as states reopen, particularly if you have an underlying illness, diabetes, asthma, other lung conditions, heart problems, or otherwise immunocompromised. I think it's still very important not to focus in so much on what's happening out there, but really to focus on you and your own health. So today I'm going to talk about 2 issues which seem to be on a lot of people's minds. Both of these issues I think are hot topics, and I want to clarify what we know and what we don't know. So first, within the last couple of weeks, several people, actually more than several, have asked me about vitamin D deficiency and its potential link with COVID-19. It's interesting. Essentially, the question that most people have is whether or not vitamin D deficiency explains some of these striking racial and ethnic disparities that we've seen in terms of disease progression, disease outcomes. And, you know, it's interesting to me because, you know, people want to find something else besides the structural racism, you know, to explain these sort of severe outcomes, which I think is fair. We need to do more research and we really need to understand what's going on. So the short answer in terms of vitamin D deficiency is that no one really knows. There's several clinical trials that are now planned to answer this question. And I think that we really need to wait for those clinical trials before we jump to conclusions. But while we're on this topic, I really do want to talk about vitamin D a little bit, because like I said, a lot of people have been talking about this. It's been in a lot of headlines. So where do we get vitamin D from? Okay, when your skin is exposed to sunlight, it makes vitamin D. Melanin, which causes skin pigmentation, lowers our skin's ability to make vitamin D. So even in the setting of sun exposure, when you have melanin in your skin, like, you know, all us Black folks do, we have lower vitamin D levels. So why is vitamin D so important? Well, we're aware that vitamin D is important for calcium absorption, and we talk a lot about the association between vitamin D and bone health, which is obviously very important. But vitamin D plays a role in lots of other systems, particularly cardiometabolic health. It's also been implicated in other chronic diseases, like even, you know, diabetes. It's been implicated in like mood disorders, dementia. It's really, there are lots of associations that are out there, you know, and I think that the jury is still out on some of those associations. But one thing hasn't been highlighted as often is the fact that vitamin D actually plays a significant role in our immune system. Okay. And really, it's about immune system regulation, or modulation is the word that you'll see, like if you read some of the articles. So specifically, what does this have to do with COVID-19? Well, in COVID-19, there's actually overactivation of the immune system. We call it cytokine storm. Not so important what we call it, but it's the overactivation of the immune system that causes these severe sort of lung injury, the other organs becoming injured, and actually leads to the morbidity and mortality that we've seen so much in terms of the striking racial disparities. So the hypothesis is that if you have normal vitamin D levels, or even some people say higher levels of vitamin D, then you're protected from that overactivation. Okay, so and then because we as Black individuals have this sort of higher prevalence of severe vitamin D deficiency, that we are therefore not protected from this overactivation, this cytokine storm, and therefore that puts us at higher risk for these severe complications. So all of that's very interesting. You know, I think it's good to know the hypothesis, but we really need the data. And I think that's what's really one of the most important things that I want to say here. There have been a number of studies which show that people who had a lower vitamin D levels, you know, had more severe COVID-19, but there are also papers that show that there's no relationship. So what do I tell patients, and what do I want you to take away from this is that the reality is that as an adult, if you want to prevent vitamin D deficiency, you can take vitamin D over the counter, 600 to 800 international units, or IUs. It's not going to harm you. You don't want to take too much of it. You know, I have some patients who come to me and said, I've been taking a lot of it because I've heard that it helps. Don't do that. Vitamin D can be toxic, especially if you're taking more than 4,000 IUs per day. Toxicity, increased calcium in the bloodstream, kidney stones, other problems. You don't want to do that. So I think the takeaway point is that if you're taking vitamin D supplementation in moderation, it won't hurt. Also, just in terms of eating, I know this is difficult in some of our food deserts, but the reality is that, you know, some of our fatty fishes, you know, cheese, dairy, foods that are fortified in vitamin D are all good supplementation. So the other thing I want to talk about, the second issue, is hydroxychloroquine. Now, apparently, Mr. Trump is taking hydroxychloroquine on a daily basis to prevent him from contracting COVID-19. So what is that all about? I mean, for the last few months, we've heard him talk about hydroxychloroquine. Other people have talked about hydroxychloroquine, and I think it's interesting, and I think that the data really at this point doesn't suggest that hydroxychloroquine affects outcomes in terms of COVID-19. Okay, originally there was a study that came out from China, very small study. It showed that there was some impact from people who were moderately ill in terms of hydroxychloroquine, but subsequent studies just haven't borne out. There's still some clinical trials that are ongoing. There's still data that's being collected. And in terms of prophylaxis, which is what he's doing, he's taking it to prevent COVID-19, there is no data right now. You know, that there are studies that are enrolling, but we don't have any data. So even if you're tempted, don't follow Mr. Trump's lead. I'll leave it at that and turn it back over to Stefan.
Thank you so much, Priscilla. I appreciate you more than you know. So I wanted to check in, make sure that Martez and everyone can you all hear me? Okay, great. So, Michelle Martez, if you could start with a brief introduction of yourself, as well as any organization affiliations you want to describe, and your general thoughts on the topic, including any thoughts about anything.
Okay, hi everyone. My name is Michelle Andrasic. I am the Director of Community Engagement and Social and Behavioral Sciences at the HVTN and faculty at the Fred Hutch in the Vaccine and Infectious Disease Division, and at the University of Washington in the Departments of Global Health and Health and Environmental Safety. I have been doing HIV prevention work for over 25 years. I started doing this work in community-based organizations in New York City, working with African-American and African-born Caribbean Islander populations in the boroughs of Manhattan and Brooklyn. And then after grad school, I found my way into research and have been doing HIV prevention research, partnering with community organizations since that time.
Thank you. My name is Martez Smith. I'm originally from Columbus, Ohio. I now live in Brooklyn, New York. I am a doctoral candidate in nursing and health science. I'm also a licensed social worker. So a lot of my experience comes from research and the various work that I've done and I'm still doing with community and policy advocacy work. I got my start off as an HIV case management intern with an organization that's now known as Equitas Health. That was actually about 10 years ago. That was in 2010. From there, I moved on to become an empowerment core group member. That same center had a CDC empowerment grant. So I did that. That was really cool. Throughout that process, I actually got involved with HIV testing and some counseling as well, health education counseling. And then I moved on from Ohio State to LIU Brooklyn to get my social work degree. During those 4 years, I did a lot. I worked part-time as a research assistant for a few different labs. They were mainly working on HIV and sexual health related studies with LGBTQ populations broadly. The bulk of that experience was with men who have sex with men or gay and bi men. From there, I moved on to U of R, School of Nursing. The interesting thing about their PhD program is that they recruit clinically trained health professionals. So there's a broad array of folks who both teach and are students in that program. So today, I'm still continuing my community organizing work. I'm a co-founder and a community organizer with the Keeping Ballroom Community Alive Network, KBCAN as it's known. So you can find more at kbcan.net. I'm also still working on my PhD, so I'm working on my dissertation research. I actually just defended my proposal in the beginning of April, and then, COVID-19 struck. So trying to just work my way, work with my community members and my mentors through that. So that's it for my intro.
Thank you. And Basola, I just want to get a little bit more from you about your background and your organizational affiliations as well. I didn't get that in your initial intro.
Sure, sorry about that. So I'm an infectious disease physician at Brigham and Women's Hospital and Massachusetts General Hospitals, both in Boston. I'm affiliated with Harvard Medical School. I work with our CFAR. I'm the associate director of our biobehavioral and community science core. I direct a lot of our community engagement activities in regards to research. My research is focused in on racial and ethnic disparities, particularly as it relates to PrEP uptake amongst women, as well as immigrant populations. But I also do a lot of other stuff, as I'm sure everybody else does. So, but thank you for having me, and I really do. I'm looking forward to this conversation.
Awesome, thank you for that. So I think I want to start the question with, can you describe what is historical trauma and what does it mean for Black people?
Sure, I'll dive into that. So, I think you know, historical trauma is really rooted in colonization and slavery for many people around the world. And for Black people particularly, if you look at our medical care, our current health outcomes, our current housing status, educational status, and other social and structural factors, all of those, all of our current realities really can be traced back to policies and rules and regulations that are rooted in this idea of race and inferiority of races. So, you know, the definition of historical trauma, which comes from the Native American, Alaska Native literature, is really the destruction of traditions, culture, in the name of ethnocide, genocide. And for us as Black people, it really is rooted in this idea of race and the fact that Black race is inferior, or has been historically seen by majority groups as inferior.
I would say you pretty much hit the nail on the head. I mean, I don't know that there's much else to it, right? I think now from there, I think, you know, and I hate to kind of like take control of the conversation, but, you know, my next logical thought is, okay, well, if that's what historical trauma means, right? That, you know, we are the victims of, you know, historical colonialism, chattel slavery, right? What does that look like today? And I think, you know, based on my reading and just based off my experience, I think we can all agree. I think today it looks like living in a racialized class, caste, racialized capitalist system. And what you see is in various ways through so many different systems, right? Even down to, right, like these algorithms that control our social media feeds, that control our search results, right? Are kind of rendering people who are not white, people who are not male, people who, right, are not of the ruling class as second class citizens. So I was just add that.
So both of you talked about historical context. Can you describe how historical trauma might show up for Black people currently?
Sure, I mean, I can talk about that. Well, I think trauma manifests itself in different ways, and it shows up differently for different people. What we have found through many studies is that historical trauma is carried by individuals and can result in things like heightened stress vulnerability. So when you are faced with stress, with a stressor, your ability to cope with that stressor may be impaired. What we also find is that stress and trauma impacts parenting, impacts communication, and can have not only physiological outcomes, but psychological outcomes. And then if you think about that in the reality that is many people of color are in high stress situations because of their race, the dealing with day-to-day microaggressions, which are invalidations and insults and hostilities based on our identity, that, you know, just the amount of stress and the toll of that stress on individuals has been implicated in health outcomes and mental health, not just physiological health outcomes, but mental health outcomes as well.
And I, just to add to that, I think there's something to be said about, you know, like the structural and social determinants of health, right? And that's pretty much a model that presents that there are determinants at structural levels, right? At legal levels, higher level, at the macro level, that interact with things in our daily lives, right? Like where we work, where we live, where we play, where we eat, where we sleep. And based off of the laws, the policies, the practices of both, you know, private and public sector, you know, be it corporations or government bodies, based off the policies that they pass historically and that they're passing out. And, you know, God God granted, God forbid, they pass in the future, our reality is that, things like redlining, right? Which still is actually happening in 2020, right? It looks a lot more insidious and it's a lot more covert than it was, say, over half a century ago, but it is still very much a thing, as people of color, generally speaking, our options are limited in terms of where we can live, where we can access, adequate medical care, even the jobs we can get, right? And you think about those things, really basic things like, right, if I can't live in a neighborhood where I have, amenities, right? I don't have, trash cans on every corner, right? I don't have access to a park so I can get out for fresh air or to take a run, to take care of myself, right? Then how is my quality of life impacted? I was doing some reading and I found out that, if I'm not mistaken, I think like the highest rates of asthma either in the state of New York or in the country or something like that are in the South Bronx, right? Why is that? When you kind of start to peel back the layers of the onion and you kind of study the history of the Bronx, Bronx is burning. Where does that come from? That come from when they built the Cross Bronx Highway, right? And things, the city burned down, right? The south part of the city. And to this day, there still impacts there. The air is dirty, so people can't breathe. That's why that's driving the asthma. I think about the area that I live in. It's one of the highest rates of COVID-19 diagnoses in the state of New York. Just around the corner, SUNY Downstate, they actually made it's a designated COVID-19 hospital, right? You walk further down, you see that there are liquor stores, plenty of bars, you know what I'm saying? But where are the vegan restaurants, right? There are a few, but there definitely aren't as many as if I were to go, downtown or to the other side of the park. So I think, those material conditions, right? And what we do have access and what we kind of have to fight to get access to or kind of do a little bit more research to get access to, i.e. healthy food, are how, those things show up today. So.
Yeah. And can I just add to go ahead.
Go ahead, Michelle. No, I gave the clinical update. I wasn't really supposed to say anything else. But no, let me just say that as a clinician, the way that I see some of this manifest is really around mistrust. I think whenever people talk about medical mistrust, they tend to point to these egregious instances, as though that was a point in time and maybe it had long-term effects, but it was a point in time. So it was Tuskegee, it was Henrietta Lacks, but what it is, it's a chronic baseline situation of inequity. That's why people don't trust healthcare institutions, whether they be clinics, hospitals, public health, government, or individual healthcare providers. So it's one of the things I think is extremely difficult to overcome, but I think we need to understand the roots in this history of trauma.
Yeah, and that's exactly what I was going to say. I think, one of the insidious facts of our reality today is that many people are like, well, that happened a long time ago, and shouldn't you be over that? Isn't that, something that, happened like 50 years ago? And the reality is, is that medical science was based in this race-based science for a long time, and we still see the after effects of that. This race-based science said that just because of our race, we could withstand heat, we could withstand pain, and so basically giving, support for the idea that we were laborers and could be worked literally to death. And today we see lower prescriptions of pain meds for African Americans. We see women who are Black women and Latina women particularly, who are complaining of issues in pregnancy, and those complaints often fall to deaf ears. And then when they are, when there is an intervention, it's often too little and too late. So we see huge pregnancy-related mortality, 2 to 4 times higher among Black women when compared to their white counterparts. And I think it's no coincidence that much of the literature shows that when Black mothers report pain, it's overlooked and minimized, and we all have seen for decades this idea that Black women make themselves prone to illness. It's because of our weight, it's because of our nutrition or lack thereof. you know, and that's rooted in this race-based science also. You know, when you look at the roots of gynecology, you know, when this country this country and other countries in the world banned this the transatlantic slave trade, Black women, the burden of bearing slaves was on Black women. And during that time, there was high infant death rates. And who did they blame? The Black women themselves, or the Black slave women who were functioning as midwives. And we see that discourse across the years. And if you read the literature, this blaming of Black women for what happens to them. And it's not only Black women. I'm using one case of, you know, the roots of gynecology, but we see that in Black men as well. So, you know, it makes me so frustrated when I hear people say that that's a thing of the past, or shouldn't you be over that? And really, does that have any impact? Yes, it has a huge impact. And we see it playing out in medical science and Black and brown bodies today.
Thank you for that. I wanted to pause just to see if Martez wanted to jump in.
I'm full of thoughts, but I'm trying not to say everything because, you know, we have plenty of time to talk. So one thing that was on my mind, I was actually like on Facebook last night, and a friend of mine like made a status and was like, yo, I need to buy this book for this book club. And the book was Algorithms of Oppression. Are any of you all familiar with that book? Okay, so yeah, Algorithms of Oppression. So basically, I can't remember the name of the author right now, and I don't feel like Googling. I'm gonna get this thought out. But what she discusses is like the use of big data and algorithms and things like search engines, on things like social media websites, you know, companies harvest big data for a variety of reasons, you know, like advertising, things like that. Even things like hiring decisions, you know, productivity, things like that. But what she is pretty much hypothesizing is that, you know, if you think about the people who are in control of these corporations that make use of big data most times, right? Google, right? Some other companies that, you know, some of us may be affiliated with, which will remain unnamed. Those same biases, those same racial biases that were passed down through the generations, right? When you talk about like historical trauma, right? Because this isn't just about Black people, right? White folks also carry the burden of historical trauma, right? They carry that cognitive dissonance to perpetuate it. But the people who are creating these algorithms and who are controlling, you know, these machine learning processes are perpetuating the same racial class system that we live in now, the same racial capitalism system. So yeah, it's really scary. It's really scary, right? These are algorithms, and these are kind of like deep machine learning techniques that are being applied to healthcare decisions, right? Whether or not somebody should be diagnosed or should be given a certain pathway for a certain treatment regimen, right? So when you really think about it, right, it's really deep, right? It is these very surface level things, right? Like the medical mistrust, like, you know, like the victim blaming, but it's also those really insidious things. And I think those are the things that concern me the most.
So you talked a bit about the relationship between historical trauma, and you mentioned the physiological as well as mental health implications of historical trauma. And I'm glad that you, Michelle, talked about this idea that Blackness in itself is not a risk factor for disease and health conditions, because that is still a widely held belief in many communities. I often say that everybody wants to be Black until it's time to be Black, right? Because there's this idea that people can, and Martez sort of alluded to it, this idea people can rip off of our culture, they can steal, they can malign, but when it comes to standing up, you know, there's some other sort of barriers there. So I do want to jump back briefly, because this is about COVID-19, to really talk about the impacts of COVID-19 currently in Black communities, and how you might see historical trauma playing into those impacts.
Well, you know, one of the things that we have seen here in Seattle, I am working a lot with Odessa Brown and Carolyn Downs, two names you may well know from African American history, clinics that are rooted in the Black Panther movement. And we still have many community clinics that are a direct result from the Black Panther movement. And what we're seeing here in the US or in Seattle and across the US is uprooting of historically Black neighborhoods. Now these neighborhoods are desirable, neighborhoods that were once not seen as desirable and were allocated for Black people and say, okay, you can live here. You can't live anywhere else, but you can live here. And now those communities are seen as desirable, and Black folks are being displaced. And so many of the Black people who received their services from Carolyn Downs and Odessa Brown are moving way far south, away from these clinics. And public transportation is an issue. Getting to the clinics are an issue. And we see that across the US. I see in the comments, people are saying, yes, we see this happening everywhere. Yes, exactly. And so what has been created now is that people have strained relationships with community-based clinics, have difficulty accessing care. And so these clinics, which are largely underfunded and don't have the capacity, are now moving towards telehealth and trying to build the capacity to reach people who are far away. And my hope is that, you know, if there's any silver lining to COVID, some of these organizations, and you know, I've been on some calls with White House folks asking, you know, how can we build capacity to reach these clinics? Well, we have community clinics in these communities, so fund these clinics. You know, often what we see is larger organizations that aren't in the neighborhoods that we work with get the money, and they're supposed to trickle that money down into the community clinics that are actually doing the work. And what we really need to see is the capacity of these clinics funded directly. My opinion, my personal opinion, I'll have to put that out there. But we really need to build capacity for these long-standing clinics, and we need to address the fact that folks are being displaced and kicked out of their homes and having to build new communities, and that creates more stress, can have impacts on not only your physical health but your mental health when you're uprooted, displaced. So yeah, I have a lot to say on that, but I'll open it up to my competent co-panelists to talk about that. I'll step down from my soapbox.
I mean, the idea that people are being like actively displaced during a global pandemic is oh man, that's beyond disturbing. I'm gonna just switch it on a lighter note. What I have seen, what I personally witnessed, and what I've also been able to take part in through the house ball community, the ballroom community, as many people know it, is a lot of grassroots initiatives to kind of circumvent this BS, you know, that's been a result of, you know, eons of structural lack, for lack of better words. So what I have seen is, you know, I've seen like microfinance initiatives, right? I guess, you know, and I hate to, I don't even know how this is going to sound. I guess it's better than nothing, right? But you know, why kind of settle for crumbs, right? When what we need, right? What we need are these large scale structural interventions, right? We need the capacity of these community clinics that are competent to provide care to us and competent to provide the services and things that we need in our daily lives. We need them scaled up. And it's so funny that you just said that. I can't remember who I was talking the other day, but I like had this idea of like, you know, what if we kind of subsidize mental health and you know, psychotherapy treatments for folks, you know, LGBTQ people of color who need it, right? And I found that there are already some initiatives that that are doing it. And then we had the thought, well, there are already community clinics and providers who are providing these services to our communities, the thing is that they're all booked up, right? There's such a huge need for them that, you know, there's no capacity. So then the next thought was, well, we need to beef up their capacity. So I think what you said, Michelle, was spot on. You know, I think right now we know what we need, right? We need beyond just the basic needs met, right? We need these overarching, these housing policies, right? Like I've been hearing things about rent freezes. What I would really love to see is some rent cancellation. That's what we really need there. But yeah, like we need to scale up the resources that are competent and are available to our communities. So.
There's this, I'm sorry, go ahead.
Sorry, Stefan, someone had just also mentioned a really, really important point in that, you know, there's such a long history of the criminalization of Black and brown folks, particularly Black men. And the way we're seeing that manifest today is, you know, people being kicked out of stores because they're wearing masks. You know, or people afraid to wear masks because it may make them feel more threatening. So, you know, there is a direct correlation with that and just our incessant need to criminalize Black and brown folks in this country. And there really hasn't been much to you know, change that perspective. And it is going to continue to play out in negative ways, you know, as we have seen in the criminal justice system, and now in the face of a pandemic, creating additional barriers to protecting oneself.
Yeah, the way I look at it is, I'm sorry, go ahead.
No, what I was just going to say is that, you know, I agree with everything that's been said, but one thing that really bothers me and what I would like to get to the root of is the fact that this is an emergency response, you know, and the fact that when the emergency is over, all of these middlemen are going to leave, you know, and what's going to remain is the same thing that was there before. So then what can we be doing about this? Or what can we, you know, sort of preempt what we know is going to happen to move to another level? You know, everybody's saying this is like a bellwether event for racial and ethnic disparities. What do we really need to be doing? Because I think we, as a collective, we need to do something.
You literally asked the question.
Oh, I'm sorry.
No, that's fine. That means we're all aligned here. That's great.
I mean, I hate to sound like cliche, right? So tell it on the mountain, but I mean, I think so much of our strength, and I'm seeing it. I'm like during a global pandemic, during COVID-19, right, which literally changed our lives in the blink of an eye, right? Because literally before we went on lockdown, my best friend was in town celebrating his birthday. We were out partying, and then we get home and we're like, oh, the city's going to be shut down on Tuesday. I'm like, okay. And so from there, I mean, I had to just say and reiterate and really just drive home that so much of our strength and our resilience really lies in our connections and our collective as a community, right? I mean, for me, that's how community is the only thing I've ever known, right? My family, the people, the friends, and the biological family who I consider my family, and building with them, that's the only thing I've ever known, right? And now, more so than ever, we're having to be intentional about how we're building, right? So, and passively, just granting a friend $20 when they ask to borrow it, right? Like, no, like I'm actually having more active conversations about like financial literacy where appropriate, right? Because a lot of folks are just not even in that headspace, right? A lot of people are suffering from unemployment, but I'm really just taking it day by day, but I do feel you, right? We need some type of long-term, we need an end goal, right? We need an end goal. God forbid this happens again, or when it does happen again, right? What are we gonna do to ensure our wellness, our collective safety, our collective health?
Yeah, and I'll say it again, I've been a huge proponent of building capacity. One of the things that is a direct result of historical trauma is that we don't have the generational wealth that our counterparts do. So our institutions aren't endowed. We are not well funded. And this idea of giving money to another organization that is not led and decisions are not made by people from the community, and then entrusting those individuals to dole out that money accordingly is not framework that is functional for our communities. And we've seen that that doesn't work.
I'm almost tempted to say, just kind of based off of some of my personal experiences, particularly with Black male CEOs, right? That, like, you know, that idea of this trickle down economy, or that we'll get this $1 million to a health department and expect them to kind of divvy the funds, you know, equally as, I would almost say, you know, I hate to sound like conspiracy theories, but it's almost like a reinvention of that racial caste class, you know, capital system that I'm talking about. You know, historically speaking, right? How many successful Black-led organizations, Black-led initiatives are there, right? Like they are out there. I don't say it to minimize the ones that exist, but for lack of better words, right, there will only be so many, precisely for what you just said. Like, we aren't endowed. We don't have access to the generational wealth that has been accrued, that essentially our country has been built on, right? And that we are, you know, in turn oppressed by every single day. Yeah, this is a lot. It's a lot.
Yeah, I would love to see the historically Black colleges and universities and the historically Black medical colleges funded to do the work that they do, because many of them are in communities that are hard hit by COVID and have deep reaching ties to the community. And I was on a call with all of them a couple of days ago, and the reality is that they don't have the capacity to do the work. They have the relationships and they are well established in the community, but they have to look to other institutions in their general vicinity, other more well-established, well-endowed institutions, to partner with them to ensure that they have the finances that they need. So my hope, and I'm hoping that it's not Pollyanna, although it probably is a bit pie in the sky, is that the silver lining will be that those institutions will see that we need to ensure that they have the capacity to be able to respond to these emergencies as they arise in the future, because they're already there in the communities. They've got the trust of the communities. You know, Meharry and Morehouse and Howard don't need to build trust in the Black communities that are around them. They have it. They just need the capacity to be able to do what they do well.
There's, at least in my perspective, there's this tension in the school of thought about how do we build our own versus how do we take what's ours. So I'm sort of curious, because we've ventured that way into the conversation. I'm really curious, the points that Martez raised about the microfinancing and the grassroots efforts to build capacity for people in the community to respond to their own needs. The houseball community, of which I'm affiliated, and then this idea of also building capacity of current institutions, right? How do we move forward with strategies that do both, right? And what is the responsibility or accountability of the current system to either support or to get out of the way?
That is a very profound question, and a very layered question. In social work, we teach no double barrel questions, so you ask one question at a time. No, I'm joking with you. But I don't know, I think, wow, like, there are so many ways. I mean, so for me, right, my career aspiration is to go into research, right? And so for me personally, what that looks like is I want to do community engaged, community-based research, ideally community-driven research, right? So this is research that is prioritized by folks who are living within these very specific contexts that we're discussing, right? Who are very dedicated towards, you know, liberation, right? But more importantly, like, yo, I need to find an institution with an endowment. Like, I don't want to take on a job that is not going to give me what I need to not just do what I need to do, but actually transform what it is that we need to transform and ensure some type of longevity, right? We need to, I hate to say it, I think it sounds so cliche a lot of times, but like wealth redistribution, right? And not just like, not just like the microfinance, initiatives, those help, but I mean like real live, like how do we put assets in the hands of Black people? Not just any assets, but like assets that have the potential to impact society in the same ways that white folks have been impacting, society since the beginning of the United States. It's going to take us a while to get there, but I definitely think it's possible, right? It all starts with the dollar and a dream, right? So that's what, like, for me personally, what it looks like. But I think, it's kind of like those, it's not an or thing, it's kind of one of those and things, like, right, we continue the microfinance initiatives where folks with very specific career goals, right, finding ways to kind of maximize your productivity while also engaging and liberating the communities that you come from, right? For some folks in government, that might mean looking like appointing more people who look like us, who have our experiences from our communities, who will do that high level advocacy and legal work, right, of implementing those policies. It's definitely going to be an uphill battle just from, what we know about our country and our this global anti-Blackness that we live in. But it's possible because we say so.
And I think there are lots of organizations that are doing the work, and there are many, many examples of success stories across the country. And, we have seen incremental changes in acquisition of wealth, in some health outcomes, in educational attainment, and other social factors. So I think part of the challenge too is for us as communities to also see what is working and do more of that. And I think that can be challenging when we are spread out, largely working in organizations that are led by majority folks. There are multiple challenges, but I think, Martez, you bring up a good point, doing this community-based work and ensuring that community is always involved in the work that's moving forward and getting as many people at the table, and as we attain positions of leadership, opening those doors and, putting a truck in front of those doors to ensure that they remain open and, ensuring that we support and mentor Black and Brown folks to get them into leadership positions and to ensure that they have a voice, and not only that they have a voice, but they know that they can use that voice. Because there's so much imposter syndrome in many of these organizations. And I think, that it's, the responsibility is for all of us to ensure that none of us feel like imposters.
I'm right there with you on the imposter syndrome. That is something I deal with on a daily basis. And it's so interesting because I just guess, like, from the outside looking in, I don't think that my white colleagues really suffer from it as much as I do. But right, that that's how historical trauma, intergenerational trauma, presents. That's how it shows up, right? I'm not good enough. I can't, right? But yeah, and just to kind of feed off your point about using that truck, somebody comments that I like that truck image. I love it too. I was doing some reading and I found that for job connects, the majority of people like successful job hunts, they usually succeed in their job hunts because they knew somebody at the company before they applied or before they went to an interview, right? And so, right, knowing things like that, and knowing how we have a historical legacy of moving, within our community and through our own communities, right? Keeping those things in mind, right, and using those things as personal leverage and communal leverage in various arenas are really, I think, are going to be key strategies among others to really achieve what it is that we need to achieve and really fill those gaps. Somebody also made a comment that said it's not necessarily that we don't know what we need to do, more so that we need the resources to fill those gaps. And I couldn't agree more. One of the things that I thought while I was preparing to come on to today's discussion was, man, like I feel like we legit have everything we need, right? It's just a matter of, right, coordinating things, right, and kind of organizing things, and getting the resources, right, to actually do what it is that we need to do. So.
Thank you for that. I think both of you, and as well as quite a few folks in the chat comments, have articulated that we have assets. We have assets, and part of, in my mind, the development of these assets has been one part resilience and one part determination to survive and to thrive. I guess my question is really about how to move forward, given everything that you all have said. So we've talked a bit about the issue, but I'm not sure we've talked enough about the transition. And so if historical trauma represents all the things that you all have contextualized in this meeting, I guess the first part of my question, Martez doesn't like double questions. The first part of my question is, how do we break down this in our communities? In my mind, I think about historical trauma and the systems that it has erected in our cultures, in our societies, in our communities, as being part of a disease. And so how do we treat this disease? How do we treat and triage these issues, particularly when I think about someone getting on national TV and talking about and suggesting that he was right in calling a woman sex worker to give oral sex to his son as a rite of passage into manhood. And I think, and the transition or the connection for this to me is thinking about not just the ways that historical trauma has showed up in the systems that you all described, but on the individual level. How does it look in the pathologies and the sexism, the patriarchy, and these other things that we have assumed? And how do we, with these assets, how do we move forward carrying these things that we still are carrying with us? How do we separate ourselves from that, right?
Such a layered question, right? I guess the first place that my mind goes when you bring up, that particular situation, you can't do something for somebody that they don't want for themselves. And I don't say that necessarily to say that all Black folks aren't necessarily interested in the notion of identifying how their historical trauma manifests in their personal lives, right? I think everybody at some point in time, right, will kind of question that, right? It's just a matter of, do I have the language, right, to even contextualize this as historical trauma, right? Because this even right, you talk about access to knowledge, right? I think the fact that we're here having this conversation right now does put us, though we may not want to admit it, in a very privileged place. But when you think about things like Stefan mentioned, I don't know that we make it our business necessarily to help every person, more so as make ourselves available and make those resources available when the time comes for those individuals, right? So I think for me, and what I may be struggling with right now, I think is, for me, the way I move through my healing, right, is learning more, reading, right? There are people, and I think who are hopefully the majority of us, the majority of our community is definitely interested in that. And so I'm always like, okay, first of all, if I'm going through something, if I'm having some type of symptom, the first thing I'm going to do is try to find a credible source to read up on it. That in and of itself, right, is a loaded conversation. How do you find credible sources, right? But just reading about it, talking to people. I think there's this huge stigma, and God forbid, it's 2020, but it's still very much there around, mental health services. And I think more so on competent services, right? I think I know a lot of folks in my personal circle have access services, and it wasn't that there was this stigma that about them having to talk to somebody, more so that when they finally went to speak to someone, they didn't find what it was they were looking for. 9 times out of 10, because of cultural differences, right? I need to speak to somebody who looks like me, who shares those same experiences. identifying it, right? Like if you have a symptom, like, right, try to get outside of yourself, try to talk to somebody, hopefully a professional, right? I'm gonna just leave it there. So my mind is going many places right now. I'm gonna just leave it there for now.
Thank you.
And I also think, I mean, if you think about historical trauma, we really need to attend to it in a trauma-informed care way. Often when our communities are discussed, they are discussed or viewed from a deficit-based perspective. So how do we flip the script and base these discussions and the way we move forward in a strength-based and empowerment sort of model? What are our strengths? How do we take those strengths and pay attention to sort of issues of power and hierarchy that have the potential to re-traumatize us, like the mask wearing criminalization. How do we come together as communities to ensure the safety of individuals in wearing their masks, and how do we foster growth and promote resiliency in our community? People always talk about, or I shouldn't say people, I always think of resiliency sort of as this double-edged sword, because we do need resilience to cope and to manage the stressors that come up in our life. And at the same time, we need to be actively fighting and advocating against the things that require us to have resiliency, and realize that the way things are is not the way things should be, recognizing where the system is broken and how we can fix it together. And that means that we have to increase people's access to choices, options, sense of control. One of the things that I think is really great, Stefan, is that you open this sort of with a meditation and a self-reflection. I think the more we as people feel like we're in control of the situation and we can either change or improve the situation, the better that the better that we can be as communities and as people. And I think also the thing that I also like about trauma-informed care is that it recognizes that we have historically pathologized people for their attempts to cope, and most of us have not taken coping skills classes. We don't know how to cope with things 100% effectively all the time. Many of us have learned how to cope, from our family and our parents who may have been dealing with their own, they're dealing with their own stressors and traumas. So, how do we acknowledge that we as a people have histories of trauma and not pathologize ourselves and be more supportive and understanding of each other in our efforts to move things forward and to improve things? And I think, having better social support and attention to how people are feeling and obviously I'm a psychologist, so these things are incredibly important to me, but just having each other's backs too, that's really what it comes down to in these efforts. And identifying what is working. I mean, I said this before, but really identifying what was working and how we can support each other to make them better. And that requires some really a real focus on, the things that are making a difference in our communities and things and how might we as individuals contribute to that.
Can I ask just really quickly, thank you for saying that. Can I ask really quickly, how might we consider or think about disengaging, pathologizing other people's coping strategies when those coping strategies are negatively impacting us on an individual or community level?
Mm-hmm. So I think, the thing with coping, again, is that none of us have taken a coping skills course. And often we engage in behaviors to cope because at some point they were working for us, or in some situations they have worked for us. And then what happens with some of these coping skills, and substance abuse is a prime example, is that they stop working. And sometimes they stop working in an incredibly devastating way. And I think the more supportive we can be of each other while ensuring that people are respecting us as individuals and respecting themselves as individuals is key. I think, recognizing that someone has coping skills that are not productive and that are negatively impacting on our lives is something we have to call out. Not only to respect ourselves as people and respect our own right to not be treated in a certain way, or not be taken advantage of, or whatever the situation is. And that requires communication skills, and communication skills in a way that's not judging you because you haven't learned to cope, but recognizing that what you're doing is not working for me. And is it working for you? That's the question. Maybe at some point it was working for you, but is that still working for you? And are you coping effectively, or has this become a destructive sort of coping mechanism? And I think that's the key. And communication is also something we don't learn how to do.
It's so layered. You see how layered it is?
Yes. And so communication skills are really important. And I think often, what I've seen in my own personal life and when I was seeing people in therapy is people feel like sticking up for themselves, or, saying, this isn't working for me is, somehow not supportive of other people, or putting them down, or not being there for them. But my response to that is, can you be there for someone and not be abused in that relationship? We have to be there for each other and not be abused, and be supported and mutually supported. It's reciprocal. And when it becomes abusive, then it's no longer mutually like a reciprocal relationship.
I mean, I probably couldn't be with you any more on your sentiments. I have a brother, right, who has struggled, right, with substance use, right, and it's been very challenging for our family. But one of the things that I've always done as a social worker, right, in my training, right, you meet people where they're at, right. So as you eloquently stated, right, how do I gently find a way to coexist with this person while setting boundaries that allow me to preserve my sanity and my health and my well-being, and also kind of like gently raising my concern, and kind of maybe calling attention to your behavior and saying maybe this is something you need to reconsider, right? I feel like it's almost like an art, right? There's an art to doing this. I think it's something that's kind of innately within us, but we learn by trial and error. I think that's what I like to call being in the trenches with people, right? I think because of our historical trauma, because of what we've endured historically, right? Some of us, I know I can speak personally, for me, I'm generally one of the more accomplished people in my social circles, and that means that I have access to a bit more knowledge, and so I have to be more intentional with how I use it, i.e. effective communication, boundary setting, modeling, right? Not only how I want to be treated, but what I think health looks like for myself, and hopefully, other people, learn from it, and vice versa, right? But just kind of adding off of that reciprocity point that you mentioned, right? So much of community is essentially that. It's being in a reciprocal, mutual bond, loving bond with somebody. So yeah.
Thank you for that. I have a few questions from the chat box, or from the participants today. The first question is, what are your thoughts about mobilizing a Black community in a wealthy country that ignores and harms Blackness?
Repeat the question one more time for me.
What are your thoughts about mobilizing a Black community in a wealthy country that ignores and harms Blackness?
Well, if I'm going to be completely and totally honest, I always look to, you know, I think probably one of the best organizations of the Black community that we have to date, which is the Black Panther Party and the Civil Rights Movement. And I think learning from those efforts and also trying to transcend those efforts, because I think what has happened as a Black community is we had this amazing Black pride and leadership movement, and then literally the leaders of that movement were targeted and assassinated and jailed and discredited. And I think we don't talk enough about what that has done to the general psyche of the Black community and what that means for us now to organize as a people and to really embrace Black pride and to do meaningful things for our community. And as I talk about it, there's a pain there. I'm feeling a pain to that, because I know that all of us feel a sense of loss because of, I think, what happened in the civil rights movement with the Black Panther Party. And I don't think that we have ever discussed how to move past that in a real honest and emotional way. And so we are left with the legacy of that reality. And, you know, looking back on what happened, and I mean, we still have, you know, leaders in our community who survived that movement, that weren't murdered, that weren't jailed, that weren't, you know, discredited forever. They tried to be discredited, but weren't. So I guess my question is, how do we collectively move past that? How do we build? And I see here someone collective self-esteem, you know, to get back to a place where we feel safe and empowered to have Black pride. And I see it happening here and there. And I think the younger generation is embracing that and moving that up. But I think that in order to do that, we have to really, really talk about what happened the last time that we did that, and like sort of address the elephant in the room, which I often don't hear in many of these conversations moving forward, which is the last time we tried this shit, look what happened to us, you know, and we don't talk about that. And so there's a level of fear, a level of mistrust that whatever we do is going to be met with violence and aggression, period.
It's so, I don't think it's ironic that you speak about this. And I, like, you know, just the other day I was reflecting on a personal experience I had, you know, with activism and social organizing, right? And being very just visible, right? And with that, it scared me. It scared me precisely for exactly what you just stated, right? That's historical trauma showing up, right? Like alienating the work, not necessarily alienating it, but just kind of like, you know, being fearful, right? In doing this work as a Black man, right? And for me, the best to do, right, aside from going to therapy and privilege, but I think I had to refocus my personal efforts, right? And so, you know, one of my mentors was just like, yo, don't be no pup with your pen. And so as a public health researcher, how do I affix my pen to a piece of paper, right, in a way that is liberatory, right, but still kind of like falling within the realms of respectability, right? Do I just discard it, right? Kind of going back to something I said earlier, I do kind of believe in like, and I believe in the word and. I don't think what we're playing is like a zero-sum game, right? I think this is very collective, right? We take multiple approaches to get to one end. And so again, like me personally, as a public health researcher and scholar, I need to continue working within those realms and really just challenging my colleagues who use these very problematic, theories and frameworks to further pathologize us. On a community level, again, like I keep that term asset building that you all mentioned earlier just keeps, it's so profound. And just to take it a step further, I think we know our strengths, right? I think now that we take the assets that we know that exist, right? Our collective resilience, our capacity for collective healing, right? Our oration, our oral history, right? Tradition. We take those things and we start putting them into action. I think for me and my community organizing work, what we've been trying to do is, like forget the grants. At this point, we're just ready to start fundraising our own because we know we have the capacity to do it and start really just fundraising, like, pushing some of our own grassroots initiatives. And I think just to take it a step further from just, funding initiatives and raising their capacity, I think we, as researchers, right, we should be the people who be working with them to generate data around these things, right? We live in a capitalist society where, money talks BS, right? Y'all want to see all the numbers and the outcomes, all that to you. And a nice, pretty little report with graphs and charts and things. That's my 2 cents. So,
thank you for that. I have 2 more questions. The first is, what is the best way to implement a resiliency-based approach while working and living within whiteness? Y'all came with the questions today.
When I think of that, I just think of like breaking down what does resiliency actually mean, and like, so how do we give people more options and choices to feel like they're in control and that they can choose a way forward, to increase agency, to increase our self-efficacy, and then not only self-efficacy, but self-esteem. Like, how do we increase our own worth with all of these messages that are targeted towards us and this lie of inferiority? How do we communicate to others, to our children, to our community, the worth that we have as people, and that we are strong and have a rich history, and that we are worth fighting for and worth standing up for and worth speaking out for. And so, I try to unpack it in those ways. And then, with social support, how do we ensure that our communities not only have what we generally think of as social support, which is that sort of emotional support, someone to go to when they need someone to talk to or listen to, but also tangible support. Like if you need something, if you need food, if you need someone to take care of your kids, is there, do we have resources for people, to get the support that they need? And those are really the building blocks of resiliency, ensuring that our communities have those things, builds the foundation for resilience in the face of whatever comes to our communities.
And just to add to that, so I said a really interesting comment, approaching resiliency in a slower process that incorporates actually healing from intersectional traumas and wounds before bouncing forward. And I think, right, the first thing, 2 things come to mind. The first is like breaking the cycle, right? Well, how do you break the cycle, right? Kind of leads back to that healing point. But I think for me, and I'm right, it's being able to name, right? So if I'm experiencing symptoms, I wake up tomorrow and I'm experiencing symptoms, instead of just kind of saying like, oh, I'll just brush it off. No, like let me sit with that for a few minutes and actually interrogate, put some words on it, right? And in addition to that, I just think just kind of, this isn't tangential, but it's still related, right? To, how do we kind of promote resilience in the face of suppression? You start with, right? So if I start with history and I tell my history that I know to be true, that so much of, if not everything of what I know to be true about myself today is, or what they tell me is true about myself, is more than likely rooted in lie, right? I think, and then I can share that history with the masses, right? I can teach nephews, which I have about 20 of them, right? I had these conversations with them about, right, like, here's a history that you don't get in school that's actively suppressed, right? And then that kind of feeds off of what was, I don't know if it was in the comments or somebody, or if you mentioned it, about building self-esteem, right? If I show you who you really are, not necessarily who society tells you are, right? And I do that at a young age. Just think about, even for myself, if I had learned African American history, just African as a even in middle school, right? Also when I was 21 and a junior in college, right? How that would have just profoundly impacted my development, right? And so I think we take things like that, right? When we start with the children, but more importantly, we also apply it to ourselves in our personal lives, like via the mechanisms you said, right? Social support, right? Being there for people emotionally, instrumentally, right? And talking to each other. We have to talk to folks about our problems so we can process. So, yeah.
Awesome. What's your advice for Black folks who are one of few in a predominantly white organization trying, emphasis on trying, to do outreach with the Black community around HIV or COVID? I often feel the burden of underrepresentation, and it has impacted my physical and mental health.
Well, this has been my reality for the second career that I've been in. So I'll speak from my own personal experience, and that is to ensure that there are more people like me who look like me around me, like whether it's reaching out to other community-based organizations that are predominantly people of color, like joining in their efforts to find out where there's overlap and where we might be able to work together and build relationships and partnerships. And then, as I have advanced in my career, hiring people who look like me and ensuring that the people who are working with me, share, not only my identities, but also, the same outlooks and so forth, and I think, in the process of doing this, many people are like, you hire a lot of Black people on your staff. And usually my response to them is, it seems like you hire a lot of white people on your staff as well. So, I think, we have to try to build what we want our reality to be. And, even if you're not in a position to hire people, because I know that there's power and privilege with that, just reaching out and creating partnerships, even outside of your organization, with people who are doing the work. I found that to be incredibly effective in the past when I have been doing HIV prevention work. And even other communities of color, and often in the past, I've reached out to Latino and Latino organizations, Native American organizations. There are a lot of similarities across our different groups in terms of how we are impacted by social and structural factors. And those relationships can be really key.
Yeah, I agree wholeheartedly. Like, being, I was the only Black student in my I'm the only Black student in my cohort. And so, I depend on my professional and personal relationships with Black people that I've made outside of those institutions and outside of those spaces to really thrive, right? And I'm not saying that the connections that I have with the white people at those institutions are like toxic, right? They're not, far from it. But I need to be around folks who look like me. And so I make sure I'm very intentional. Just, thank you. Like, Michelle, you're such a blessing right now. But that's exactly what I do. Like building that social capital, being very intentional about networking with Black people and other Black people who are doing this work, right? As you stated, those are two things that I'm always doing. And then more importantly, I've noticed, especially now more than ever, right? Making time for my self-care is if not the most important thing, it's definitely somewhere at the top of the list. And that looks different for everybody, but I know for me, it looks like, turn off all of my screens, candles, maybe reading a book, maybe you're doing some meditation, some prayer, right? Turn on some gospel music, writing in my gratitude. So just not abandoning those really small but important and really critical self-care habits that we have for ourselves can really, for me anyway, it's helping me kind of like just get through the day by day, you know, the mundane. So.
Yeah, agreed, Martez. I just saw someone in the comments also wrote, you know, like if our communities came together and, you know, fought together, and there's so many historical reasons and really like proactive movements that have happened to keep us divided. And, you know, when you step back and you see how the social and structural factors impact us all, you know, pretty much along the same lines, just a different flavor depending on what your identity is. We could be much stronger if we were together, but the same mechanisms that have historically kept us apart continue to do so. And so it's really up to us, you know, to make that change.
And I think like I'm reading the comments, and I feel like so much of the comments is so related to our comment. I think it goes in spaces like these, kind of like these kind of like create nexus, right? They create networks, they create change, right? Or they help continue that process on. So yeah. Somebody said like going back to your comment, you know, last time this stuff happened and we didn't talk about it, which is why earlier, you know, I made the comment about, you know, like, yo, we gotta, for me anyways, I need to talk to my nieces and nephews, right? And my gay children about like, no, here's your history, right? Here are all the things they told you that you were not. Here are the orchestrated efforts, right? Like the COINTELPRO, all of that, the crack in the 80s, you know, even today, right? Some things that don't sit quite right, right? And that was why I think early on I mentioned the algorithms of oppression, right? Because whatever you on the Zoom call, right? I shared this via my social networks, right? And so if we're kind of like a curve, right, for the next wave of oppression or what it's going to look like, right? You know, it's almost like we're back at square one. I feel like it's like we're fighting like so many battles all at once, right? Which is why I say when you ask some of these questions, my mind goes to so many different places, right? It's like how you begin to organize all the things that we need to do to really get to where we want to be. So.
Some people say one day and one step at a time.
Yeah, exactly. And I do think it's about, you know, educating our communities and our youth, you know, and pointing out to our children, pointing out to our communities what happens when Black men take a knee at a football game, and comparing that to what happens to these people who are protesting in the city halls with guns, like an armed militia. And what are the differences between the reactions to these two groups? And does that seem right? You know, and this is what I ask, you know, the kids in my life. What about that seems equitable? You know, and if it is not, what's that about, and what do we need to do about it? You know, what is so dangerous about a Black man taking a knee at a football game, and yet we have hundreds of white people showing up at City Hall with guns, and somehow that's not dangerous?
You know, somebody literally just said it, took the words out of my mouth. This is Versal Milton. We be the most powerful force for change whenever we come together. That is also the greatest spirit that comes together against us. I mean, like, yeah, y'all white folks is afraid. They've been afraid. Man, you know, my views do not represent my employers. So I mean, I just need to get that disclaimer. I mean, we know it, right? That's the elephant in the room. Is if we all came together. Why do you think, you know, historical disenfranchisement is a thing? That's another thing that I really want us to really like talk about with our kids, right? I want us to really talk about our kids about not only about like the lies, but really talk about like how historical disenfranchisement has operated and how it is continuing to operate and how it's probably going to manifest itself over the next decade or two, right? There's a reason why when I talk to so many like young queer kids of color, young queer Black kids, why they move in like these really tight-knit packs, right? that's them trying to defend themselves against all the structural bullshit that's coming their way. Excuse my French. Oh man, mama, I can go so many places with this. So yeah, we need to talk to these babies, but more importantly, like before we can't talk to the babies unless we're educated ourselves, right? Which is why, you know, I think this is like a social worker in me, right? Like the motivational interviewer, I'm always just like, okay, well, let's explore that, right? On a scale of 1 to 10, how much are you ready to change this and really get serious with yourself? I'm gonna stop talking for now.
Well, we are actually at just about time, so this came together really well. I guess if you have any final thoughts before we sort of conclude or wrap up.
I just say, what do we need to do to bring us all together to, you know, to make the new reality? You know, and I know that there are different community-based actions that are going on now in all parts of the country. And I think, you know, the challenge is to coalesce all of them and to really move forward, to have some real social change, to ensure that we learn from what's going on right now and its impact on our communities, and ensure that it doesn't, that the next time something like this happens or whatever else happens, that we have put ourselves in a better place.
Right. And just to add to that, you know, I'm always thinking about the work that I do in the community. And I think for me, like COVID-19 has just really put a spark in me to just kind of take everything that I'm doing in community, both the research and, you know, the organizing efforts, and really try to start to escalate that stuff up to policy level, you know, be it local, state, federal, like really just get involved in that policy work, right? And then going back to your points that you made earlier about, you know, just so like reciprocity, right? And being in community with folks. We have to be intentional about, for me anyways, I'm gonna speak for myself, I have to be intentional about continuing to build myself and build my community around me. I'm a firm believer that, like, you know, when you make changes with yourself, they radiate outward into your social networks, into the people that you're connected with. So if I prioritize my health in whatever way that's feasible for me right now, ideally, right, in a perfect world, it will radiate outward, and all the people that I'm connected with, right, the larger Black community, will benefit in some way, shape, or form. So those are just kind of like a couple of the principles that I just keep with me in my day to day, right, and just keep practicing that self-care whenever I can. So
Thank you both to the amazing panelists, Michelle Andrasik, Martez Smith, for coming on and talking with us about these very important issues. Chioma, did you want to close out?
I just want to say thank you, Martez.
Thank you both.
Excellent panel. So thank you everybody for joining us. Thank you to our panelists, amazing conversation. I know folks were talking and continue to talk in the chat and just connecting with what you all are saying. We're asking people, please look out for our next webinar. It will be in 2 weeks. And so you will get emails, follow up with us. This webinar will be sent out to everybody. The recording will be sent out so you can share it with other folks. And we will see you in 2 weeks. Everybody continue to be safe and be well.
Thank you. Take care.